You were called in to cover for a sick RDH. When you check the next patient's file, you find that the record of treatment and billing units are already completed, without the patient being seen yet. You check the other patient's files and find that they are also already filled out.
Oh no, I don't think I can get through the day.
That's okay, Janice. We will call another RDH to cover for you today. Please go home and rest. I hope you feel better. Hi, Ginny. I hope you are doing well. I'm calling to ask if you would be able to cover Janice for today. She went home because she's not feeling well.
Oh, absolutely. I hope she feels better. I'll be there in 30 minutes. See you, Dr. V.
Ginny comes to the office and pulls up the next patient's file to prepare herself for any medical alerts. However, she is flustered when she sees that the record of treatment and billing units have already been filled out.
What in the world is going on here? She might have confused herself and mistakenly wrote it in the wrong client's file.
Ginny proceeds to treat the rest of the clients and rewrites the record of treatments and billing units following proper guidelines for record keeping. At the end of the day, Ginny is in bed, unable to sleep. She's tossing and turning, unable to stop thinking about what she should do about this situation.
I really need to do something about this. But what should I do? Maybe I should talk to Dr. V and tell her what Janice is doing. Then I'll let her handle this.
What? I can't believe this. I will fire her.
No, I can't let that happen. Should I talk to Janice when she's back in the office and tell her that what she's doing is wrong? You know what? I've already rewrote the ROT. Maybe I could just leave it like that. How about I suggest to her courses for ROT and billing units? Would she get upset by that? Or I could just call CDHO and ask for their advice. What should I do?
Ginny finally decides that she is going to talk to Janice about the situation. However, like with all other ethical dilemmas, there are two different outcomes.
But what if it turns out bad and she gets angry to me? No, she's not like that. I should just definitely talk to her.
Despite being afraid of the outcome, Ginny decides that she is going to confront Janice about the incorrect documentation and approaches her when she gets back.
Hey Janice, how are you feeling now?
Better. Thank you so much for taking my shift last time. That's a really great help.
No, don't worry about that. It happens, you know. But I'm glad you're doing good now. I just wanted to ask you something though.
Sure, what is it?
I just noticed that you've already filled out the ROT in billing units before even seeing your clients. I'm just worried that this isn't proper and could get you in trouble. I think this is ethically unfair and could compromise your client's safety.
Oh, I never realized that it was wrong. You know how busy we are in the clinic. I thought that this way I could save up time and get my work done. I honestly don't think it's harming anyone.
There's a lot of things that could go wrong if you continually do it this way. Don't worry, I'll help you out if you have any questions about your documentation. You can also take courses about record keeping so that you'll be refreshed about the standard documentation.
Thank you for bringing it to my attention. I'll look into the courses. For right now, do you mind going over the regulations with me again?
In the meantime, Ginny guides Janice through the proper way of completing the documentation while she waits for Janice to enroll herself in some record-keeping courses. If this situation were to happen again, what would you do?